Hi, my name is Kelsey Powers, and this is my newborn assessment. My doll is very small. It's only about the size of my hand, so just bear with me. It was the only one that I could find. So first things first, I would knock on the door, ask to enter, go in and introduce myself to the parents or mother, and then I would confirm mother's name and date of birth, check the baby's band to make sure that it matches the mother, pull the curtain for privacy, perform hand hygiene, explain that I'm there to, in like age appropriate words, explain that I'm there to do a newborn assessment, just to make sure that their baby is healthy. Before I enter the room, I would have obtained the birth history, so whether or not the baby came vaginally or via C-section. If they hadn't already been obtained, or first I would do vital signs, so temp, pulse, respirations. Temp usually axillary, and then pulse and respirations would each be for 1 full minute. Respirations can be felt by placing your hand on the baby's belly, and each time it rises, that's 1. Blood pressure, we don't usually do more than once on a newborn unless there's an indication that it needs to be done more than that. And then if they hadn't already been obtained, I would measure the baby's head circumference in centimeters, right around the brow line, all the way around the fullest part of the head. And then chest circumference, which would be around the nipple line, all the way around in centimeters. Head circumference should be larger than chest circumference. And then I would measure the baby's length in inches or centimeters, from the tip of the head to the tips of the toes. And then weight would be in pounds or kilograms on a newborn scale or an infant scale, usually naked. Then general appearance, I would inspect the baby's body alignment, make sure that everything is like symmetrical, make sure that they have all of their body parts, make sure that like one arm isn't longer than the other leg, etc. So make sure everything's symmetrical. And then I would inspect the baby's muscle tone, make sure that it can move all of its limbs, make sure that it's moving all of its limbs symmetrically. And then if the baby's sleeping, I'm not going to wake it up and make it cry, but if I were to hear it cry, I would assess its cry, because sometimes like an inconsolable cry could mean that it's like withdrawing from drugs that the mother was taking while she was pregnant with it. And then I would move on to skin. Vernix, I would inspect for vernix. That is the white cheesy-like substance that coats the baby's body when it first comes out. At this point in time, it probably would have been wiped off by now. And then milia is the little white dots that might be on the nose or somewhere else on the face. Those are completely normal. Sorry, I'm just thinking. And then erythema toxicum, which is baby acne, like little zit-looking things. Those are normal. Lanugo is the fine hair that coats the baby's back, shoulders, tops of ears. It's the first hair that babies have. And then Mongolian spots, they look like bruises. They're harmless, they're like birthmarks, but they still need to be documented in the chart, so that like later on another provider doesn't see it and think that the baby's being abused. And then petechiae are the little, they're like red blotches. They're just from broken blood vessels, from coming out of the, like being birthed. And then head, I would inspect the head for the fontanelle. So the anterior fontanelle is about here. It's diamond shaped. And then the posterior fontanelle is back here. It's more triangle shaped. I would inspect both of those for either like bulging or being sunken in. If it was bulging, that could be a sign of like maybe fluid overload, or increased intracranial pressure. And then if they were sunken in, it could be a sign of dehydration. It's normal to see like a pulse on the fontanelle. And then I would also inspect for molding, which is like when the baby comes out, the plates of the skull are not fused together yet, which allows the baby to come through the birth canal. And they like shift to allow the baby to come out, so they could have like a cone head appearance. A cephalhematoma is a pooling of blood under the skin on the scalp. Again, just from birth trauma, they're normal, should go away within a few months. And then kaput, which is just generalized edema of the head, that's also normal. It's from, you know, being in the womb and then being birthed. And then face, I would inspect the face for symmetry. Make sure that like one side's not drooping or anything like that. If it was, that could be a sign of like nerve damage or something from birth trauma. And then next would be eyes. I would inspect the baby's eyes for the iris color. Usually in newborns, they're slate gray or like very light blue. And then I would inspect for, I don't have my pen light, but I would inspect for pearl, because they don't have accommodation yet. So just make sure that the pupils are equal, round, reactive to light. They're not going to be accommodating quite yet. I would also assess for strabismus or a lazy eye. That's normal, just because they've only ever seen like directly in front of them in the womb. It's dark in there. And then I would also inspect the baby's conjunctiva, make sure that it's pink, moist, no signs of discharge or infection. And then I would inspect the baby's ears, make sure that they're well formed, no tags. And then I would make sure that the top of the ear is in line with the outer canthus of the eye. And then the nares, the nose, next is the nose. I would make sure that both nares are patent because babies are obligatory nose breathers. So you can like suction them if they need it. For mouth, next would be mouth. I would stick a gloved pinky inside the baby's mouth and feel the soft and hard palate to check for any holes or anything like that. I would also inspect the gums for Epstein's pearls. Those are just calcium deposits. They're normal. While I was in the mouth, I could assess the baby's suck and swallow reflex, which will also be mentioned later. And then, let's see. So after mouth would be neck and like clavicles. You would just like check to make sure the baby has a neck. Inspect and palpate the clavicles, make sure that they aren't deformed or broken. Sometimes they can break coming out of the birth canal. Next would be chest. So I would inspect the appearance, the shape of the baby's chest, make sure it is symmetrical, make sure it's not concaved or barrel. I would inspect the baby's nipples, make sure that, not that it's a bad thing, but make sure that they don't have an extra nipple anywhere. Usually those are harmless. Inspect for engorgement of the nipples or the breast buds. That's if they were engorged, that would be normal because of mom's hormones. And then I would measure the size of the breast buds in millimeters. 2 to 5 is normal. Both females and males have breast buds. And then I would listen to the baby's breath sounds. With the bell of the stethoscope, listen to the baby's breath sounds. Crackles are normal in the first 24 hours because they've been breathing in amniotic fluid. I would also listen to the baby's apical heart rate at the apical part for a full minute. And then also while I'm auscultating there, I would assess for any murmurs. And then next would be abdomen, inspect for symmetry, distension, scaphoid, anything like that. I would inspect the umbilical cord. If it's like a fresh baby within 12 hours, you would still be able to see the 2 arteries in the 1 vein. If it's been more than 12 hours, it should have started to dry up already and you won't be able to see the 2 arteries in 1 vein. Excuse me. Assess for any signs of infection from the umbilical cord. Make sure that it is starting to dry out. And then bowel sounds are present pretty soon after birth, especially if they've had their first feed. So you would auscultate their bowel sounds if they've had their first feed. And then you would assess if they have started feeding. Ask mom or parents how many wet diapers they've had. Ask if they've been voiding since they've fed. And then you would assess for first stool, which is called meconium. It's black and tarry, normal. It should go away within 3 days. Next would be genitalia. So on a female baby, you would assess for discharge, bleeding. Those things are actually normal because of mom's hormones. And then you would also assess the external genitalia to make sure that the labia covers the clitoris. And then in a male baby, you would assess the urethral meatus to make sure that it's in the center of the glands. You would also palpate the testes to make sure that they've both descended, because sometimes one of them won't descend with the other one. And then you would also assess for rugae on the scrotum, which is just wrinkles. And then again, assess voiding patterns in both males and females. Make sure that they are producing wet diapers, how many, stuff like that. And then let's see, after genitalia, you would assess the extremities. So make sure that they have equal movement on both sides. Muscle tone, make sure that they are moving each limb equally. They have good muscle tone. And range of motion kind of goes into that. Make sure that they have full range of motion in all of their joints. I know babies don't have kneecaps, but they can still move their joints. Count their fingers and their toes. Make sure they have 10 fingers, 10 toes. To assess for hip dislocation, I can't do it on this because the babies, they're really stiff, but you would push the knee up towards the chest and then rotate outward. I mean, I guess I can do it a little bit. Rotate outward and listen for a pop, and if you hear a pop, that means that something might be slightly dislocated. And then assess the feet for clubbing. They would be like abnormally curved. And then I would flip the baby over to assess the vertebral column, palpate and inspect, make sure there's no openings in the vertebral column, because that could indicate spina bifida. And then with a gloved finger to test if the anus is patent, you would just kind of gently stroke it with your finger to make sure it like contracts. And then I would test all the baby's reflexes. So the Moro reflex is the startle reflex. So you hold baby, kind of act like you're gonna drop it. It should startle. Limbs should go like, or arms should go like flare out. The next one would be tonic neck. So that is when, so if the head was facing this way, this arm is out and this one is like curled in towards the body, like fencing. And then the plantar reflex, you would I would stick my hand on the, like right underneath the toes. They should curl around your finger. Palmar reflex, same thing. Right under here should grip like that. Already did suck and swallow with the mouth. The rooting reflex is where you touch pretty much anywhere on the baby's head, on the baby's face, I mean, and they root looking for a nipple to feed from. And then the stepping reflex. So if I were to put like hold the baby up and like put one foot on the table, the other foot will come up like it's stepping, and vice versa. And then the Babinski reflex, start at the bottom, like the bottom of the foot, go up and over, and the toes should fan out, and that would not be normal in an adult. And then the trunk incurvation reflex, where you stroke one side of the baby's back, and basically the whole body like curves inward towards the stimulated side. And then the behavioral states, there is deep sleep, which is little to no eye movement. Baby's pretty difficult to arouse. They're in a deep sleep. Light sleep, baby will move limbs, stretch, there might be some eye movement. Drowsy is like a transition phase between awake and asleep, so they're just starting to get drowsy and go to sleep. And then quiet alert is when they are just like looking. It's the best time for bonding. They're looking and listening, they're interested in their surroundings, they're focused on objects and people. And then active alert is when they're kind of fussy, restless. And then intense crying is when they're prolonged crying, strong crying. And then that would conclude my newborn assessment. I would hand baby back to mom, or if mom was holding baby the whole time, do nothing. Give mom her call light, ask if she's got any questions, make sure baby's fed, dry. Put bed in lowest position. I don't know if I said it already, but hand mom her call light. Hand hygiene, and then go document my findings. Thank you.